Hi, my name is Izzy Balden, and the topic of my flash talk today is going to be skills everyone can use to combat negative emotions and anxious feelings. These can be especially helpful for people who are high in neuroticism. So, what exactly is neuroticism? One of Dr. Shachtman's papers defines it as the propensity to experience more frequent, intense, or persistent fear, anxiety, and other negative emotion. Neuroticism is a trait which, if detected in childhood, can predict someone's risk of developing disorders like anxiety and depression in adulthood. Neurotic individuals are more prone to the development of these disorders because of their negative disposition and high anxiety. Neuroticism is a trait that anyone can have. It may be amplified by life stressors and genetics, but there are ways to combat this trait and decrease levels of anxiety and depression. Cognitive behavioral therapy is a type of psychotherapy which can be used to treat anxiety and depression. Watch this short video to learn more about CBT.
The website of the British Cognitive Behavioural Therapy, or CBT, encompasses a range of talking therapies based on the idea that thoughts, feelings, what we do, and how our bodies feel are all connected. If we change one of these, we can alter all the others. When we're low or upset, we often fall into patterns of thinking and responding, which can worsen how we feel. CBT works to help us notice and change problematic thinking styles or behaviour patterns so we can feel better. CBT works for lots of different people and problems and is widely recommended by national treatment guidelines across the UK, EU and North America. For more information...
Anyone can benefit from CBT skills, especially when faced with stressful or traumatic life scenarios. While CBT is very effective when practiced with a licensed therapist, there are also skills you can use on your own right at home. Changing of perspective can help individuals modify problematic thoughts, which will then change their behavior. Next time you're experiencing anxious or negative thoughts, ask yourself what might be the cause of this emotion. It may elicit specific thoughts and memories, and pay attention to any physical distress you may feel while thinking of this. The goal of this practice is to help you understand which thoughts trigger which emotions and how those emotions trigger behaviors. Anxiety disorders can cause people to become avoidant of situations, people, and objects which they find distressing. Oftentimes, the thoughts and predictions about these things are flawed or irrational. If you find yourself spiraling with intrusive negative thoughts, convincing yourself that you shouldn't go to that date because they'll probably just stand you up, or you shouldn't speak in class because everyone might laugh and think you're dumb, or even more mild versions of these thoughts, try and remove emotion from your cognitions and list all the facts about the situation. Rather than creating predictions for the outcome, focus on what exactly is going to happen. You are going on a date. That doesn't automatically mean that person will ghost you. You're presenting in class. This doesn't mean your words are laughable. This helps to build confidence and decrease avoidance. Negative self-talk and intense criticism of yourself decreases your overall confidence. A friend recently said to me to speak to yourself the way you'd speak to your best friend. Give yourself the same grace and understanding that you'd offer to your loved ones. Beating yourself up about minute details will cause you to remain in your negative state. By showing yourself kindness, you work to alter your cognitions from negative to positive. This also includes doing what you love. If your negative emotionality has caused you to stop activities that you were once passionate about, try and force yourself to do one or two things on a regular basis that used to bring you joy. Try to stay present in this activity, limiting thoughts regarding the future or the past. This brings me to my next point, being mindful. A symptom of anxiety disorders is rumination. Rumination occurs when you think deeply about one particular thought over and over and over. In more serious cases, it can affect sleep, focus, and avoidance. When you get trapped in your anxious thoughts, Ask yourself if the emotions you are experiencing align with the present situation. Thanks for watching. I hope some of these skills can help you the next time you're facing negative emotions.